Hey, do you know your body composition? Well, stick around to learn why it's important and how it may help you live foreverish.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. So, Dr. Crystal, I think most people know we're talking about body composition, right? I think most people obviously know how much they weigh.
Most people.
I would say.
They give or take.
Give or take, yeah. Or if people don't, they don't want to know.
True.
Something like that. But let's just say, but most people know how much they weigh. But most people don't know what those pounds mean.
Yes, it could be bone. Maybe you big boned it.
Muscle.
That's what they used to say.
Yeah, but we're finding out that a lot of that is kind of true, right?
Absolutely.
Yeah. So that's what we're talking about today is more than just knowing your weight, more than just knowing BMI. And we're going to even talk about some of the issues with just going by BMI. But this is really about body composition. It's referring to the percentage of bone, fat, and muscle in the body and how all of that is making up your body composition and weight and all that kind of stuff, right?
Yes, and the ratio or the percentages of all of the above can impact health.
Yeah. And so we have some information about the BMI in general here, talking about, what it is. It's basically your weight relative to your height. That's all it is. And it's based on the intro of this show. It's missing all that other stuff. And so right there, there's issues with it.
Yeah, there are definitely limitations with BMI. I think we will kind of talk about a new definition that's on the horizon to categorize what is considered, I would say, healthy, quote unquote. But BMI is designed to help to define a healthy weight, to define what's considered overweight, what's considered, obesity and the different classes of obesity. And looking at through the lens of obesity as a disease.
Right.
And the BMI is used to kind of give us those defining parameters.
Right. Okay. And by the way, I want to make sure people understand that the BMI still has even though we think there's limitations with it, it still has a place. It's still a good standardized thing to use in research and stuff like that. And that's really where I think it's used the most, right? It's just going beyond that and understanding more of the impact of everything else that what are those pounds, the muscle, the fat, and really thinking about body composition. I think it's a complete picture that way versus BMI, which is not.
Correct.
All right. So let's talk about, I want to get into ways that we can measure body composition, right? If we're telling people that body composition is a better marker overall of health, risk, that kind of stuff, right? How are we testing this? Like, what is it? Something I can just look in a mirror and go, "Oh, my body composition is this." What do I have to do?
Yeah, I think sometimes you can look at someone and you can see that they are very lean. They have their muscle mass is there, like very visible to the eye. But often an individual will need to undergo some of these other types of measurements. So the first one, which I love, I think it's a good solid indicator, is abdomen to hip ratio.
Absolutely. Big one.
That's a big one. And it's very simple. It's relatively easy. You can measure it yourself. I know it's a little uncomfortable to have someone else measure it. I would say that. You don't see this in your doctor's office. So I'm really surprised. Like your general practitioners, I don't think I've ever had a doctor to perform this test?
I never have, and it actually has been shown to be a better indicator of cardiovascular issues than just BMI or anything else. Right?
Absolutely, and so you're just taking that ratio, you're taking the measurement. If you want to do this at home, you measure usually right around the navel, and then the widest circumference of your hip.
Of the hips.
And then you just
divide them. And when you're looking at your numbers, men who have an abdominal to hip circumference ratio more than 1, or women greater than 0.85 have increased risk for cardiovascular disease, diabetes, and cancer. So again, we're looking at how you're distributing the fat that you may be carrying. Yeah.
Is it in the central obesity, or is it more in the hips and thighs? Because if you have more fat in your hips and thighs area, that's not as high risk
as in your belly, right?
Versus having the abdominal, the abdominal fat. So that is better than just getting on the scale, taking your weight, and then your height, and then you have your BMI. Now you're kind of looking at different shapes.
Yeah. So it's possible in these scenarios that somebody could have a BMI that says you're overweight, but maybe their waist to hip circumference isn't so bad. It doesn't mean there's not fat there. It's just it's in a place where your risk may be a little less than somebody else where it's central.
Absolutely. And I can attest to this. Many of my, being African American, you do find that the BMI is certainly not the best indicator, looking at how and where we carry our weight.
Yeah, well, we already know BMI is really good and helpful for a taller, slender person. Right? Someone that's 6 foot, slender in general most of their life, BMI is fine for that person. Somebody like me, 5'6", forget it. It's not going to give me something appropriate. Do you remember Dave Tuttle? Years ago, worked with Life Extension?
Yes.
We laughed one time because he shared with me that his BMI, I'm going to tell you what his BMI was. He was obese.
Oh.
But it was because he was 5'6", and he had so much muscle. He was a bodybuilder.
He was a bodybuilder.
He literally was a bodybuilder. He was amazing looking, but based on BMI, he was overweight. I mean, he was obese.
Right. So we do know that it's pointless if you are, athletic, if you're fit, if you're building lots of muscle, then it's not appropriate. So
abdomen to hip ratio, fantastic, great place to start. That's something you can do in your own bathroom. You can keep track of that, once every few months or whatever your goal is, right? Whatever you're trying to do, it's just a nice number to know, and you should let your doctor know. They should know that number. It should be part of your basic exam. Number 2 is skin fold measurement. This one's not fun.
It's not fun at all. This is something I had to deal with. And so I've had both the abdominal hip to waist ratio as well as skin fold measurement. You see all of this in the gym. The moment you sign up with a fitness trainer, they pull out the calipers
and you're like,
you're okay, and you're like, put your arm out, and you're pinching fat.
Yeah.
Different parts of your body. You lift up your shirt, please. Now let me pinch your waist.
The old, can you pinch an inch thing?
Pinch an inch. Oh, I've been traumatized with that too. When I was a cheerleader in college, our coach said, if I can pinch an inch, you're not cheering.
Yeah.
So talk about traumatic experiences there.
And most of the time they're doing this at the triceps, right? That's
triceps, yes. You do find the triceps, arm down, and you're pinching the back of the tricep. But also on the stomach, you get the pinch, and sometimes, to get a more accurate reading, you will find people will pinch multiple locations, but occasionally you'll just get the one tricep with the skin fold caliper. But I'm telling you, it's not really accurate if multiple people are doing. Like if you have the one person and they have their technique down, and you get your measurement, and then maybe 6 months, a year later, you measure it again by the same person, then maybe it's accurate, but
yeah. So
not
so
always.
Accuracy is a tough one on this one.
Yes.
You got to make sure it's been done right, which is important with really anything that you do. You got to make sure, even with the abdomen to hip ratio, you got to make sure you're measuring across the navel every single time. You know, don't look at yourself and say, well, if I just drop this down a little bit and then a couple inches come off. Don't know. You can't do that. It has to be, you got to be honest with yourself. And so it's the same thing with skin fold measurement. I can tell you when skin fold measurement won't work.
When?
Yeah, in Texas, we used to call it Dunlop disease. When your belly Dunlop over your belt buckle. Because those guys, we call it their beer belly guys, right? All of their fat's central. They sometimes have the skinniest arms. So if you're measuring tricep in those people, you'd be like, "Oh, you're fine," but yet their gut's like, a mile out. So it might be better to do gut side, something like that.
And the whole purpose here again is to try to estimate your body fat. It's typically considered to be in excess when it's greater than 25% in men, and if your body fat is in excess of 30 to 38% in women.
Yeah, and the caliper tells you that, right? Like people are trying to figure out, well, where does that number come from? It's on the caliper that's pinching. And based on how much it goes in or how much it doesn't, you can look at the percent, right? It shows you on the caliper.
Well, the caliper it's an equation, so you're putting it into an equation. So it's measured in, I think, centimeters. And then you plug it in.
Okay. And they tell you how to do that if you get a caliper.
Yes. I mean, this isn't one that I'm not going to do this on myself.
You're still traumatized.
I think there are other ways, what we'll talk about
let's go
next.
Let's go. Bioelectric impedance analysis.
Yes.
What? That sounds fancy.
Yes. Now, when I was a personal trainer, I did this on every new member came in, and I gave them an assessment, and we used this little machine, and you had to hold the machine out in front of you. And first, you had to make sure they were, hydrated, not dehydrated. And it's another way of measuring body fat. And the way it's working is, the body's mostly composed of water, those ions. So it's sending an electric current through your body. And we know that the current flows more readily through muscle and bone versus fat.
Right.
Because
fat's going to impede that current, and you'll see that current drops, right? Yeah.
So so it gives you, now that is one, after it takes the measurement, it will shoot out the reading on your percent on body fat right there on the machine, so you don't have to do any calculations. And obviously some challenges there is if you do the hand version, it's going through one hand and out the other side.
Right. So you're holding these things, and it's
Right. So if you are lean, if your upper body is
up top lean,
versus lower body, then that throws off
like the Dunlop
analysis.
Disease.
Right. So there are some where it's doing your feet, like you stand on these electric current, metal plates.
So you got to kind of know what would be best for, like when you're looking at a client when you were doing this. Did you ever change it up, like how you did it?
No, we didn't have the metal plate version that you stand on, but some places now they have both, where you're standing and you're holding.
Yeah.
And then it
and
gives
so you
you
would utilize that based on just looking at them. We should do the feet with you. We can do the hands.
Yeah, and really, people like to see, especially if you are, dieting. We know you tend to lose muscle.
Yeah.
Or if you are, incorporating weight training, resistance exercise, it's nice to see that your body fat percentage is decreasing.
Listen, all that, it's biofeedback. It's encouraging. It's motivating, right? Right?
Yes.
Even if maybe your weight's not dropping as much as you want, but hey, my body fat percent is getting better. So that's motivating. I think with these types of machines, though, because these are currents, right?
Yes.
You got to be careful about using different machines because every machine, first you got to calibrate them, number one.
Yes.
In calibration, it should bring all machines to kind of a standard, but they're still all a little different.
Yes.
And so it's probably also better to do the same machine, right? Every
If
single
you can,
time. Just
right.
like with scales, weight scales. You don't worry if your scale's off a couple pounds. If that's the one you got your baseline on, fine.
Yep.
Keep doing that one because it's going to measure the difference or the change in weight.
Yep.
Same thing here.
Yeah. So just another strategy to identify body composition.
This one seems nicer.
It is. It's definitely, hands down, I prefer that over someone telling me to lift my shirt so they can pinch my fat.
Look at all that. Look at this. We got to get rid of this.
Gosh, it's horrible.
Talk about starting on. That might there make me want to go buy.
I'm not doing this. And I don't blame you if you don't want to.
Yeah. So that's better. That's bioelectric. Are these available for home use?
You can, yes.
Yeah. Do you have one at home?
I don't.
That's surprising.
I don't. We're going to talk about this, Dr. Mike. We're having this conversation, but a lot of these things I don't dwell on personally. I'm just all about doing things that can help my health. Yeah, obviously, to me, that's my focus. Healthy habits. I think it will all fall in place if you.
I agree, and I love that. I think that's you don't get because this kind of stuff you can get obsessed with.
Yes.
It becomes more important to be good on the test than it is just about your health.
Right.
Right. And I think you're right on. But one of the reasons we wanted to talk about this though is to really bring up the idea that there's really multiple ways of measuring how you're doing on that health journey, right? And that sometimes just the weight is not giving you the full picture, just the BMI. It's not. So there are some of these things you can do where the picture becomes more clear.
Absolutely, because it can be very discouraging if you feel like you're on the right track and you may not be seeing changes on the scale, and just knowing that scale is not telling you the full picture.
Maybe with bioelectric stuff, you realize, but I have gotten a little bit better. So that can be encouraging as well. If you start getting mad at this process and start getting mad at a machine, put the machine away and just go be healthy. Go do your exercise and stuff like that. Just don't get so crazy with this, because we're also going to talk about some other things you could do that are quite expensive.
Oh, yes.
I mean, the next one coming up, air displacement. I mean, this is about $120 per test, and it's usually not just one test, as far as I remember. It's used in the military. It's used by professional athletes. So it's a different group. Most people probably don't need to be doing. What do you think?
I would say, no, you're right. I think that, but if you are, we have people with different personalities, different health goals. If you are all in, living forever-ish on this longevity, anti-aging path, and you want something that's pretty more accurate than the assessments that we've talked about thus far, this is something, and you're starting to see these machines in some of your health spas, your med clinics, and they're offering these services, and you just go in and you just sit in this chamber.
It's a chamber. It's a sealed chamber, right?
Yes.
And basically, it's just measuring how much your body displaces air. Like, think of like a sail, right? Air hits the sail, it displaces that. That's one of the reasons you move, right? The bigger the sail, the more displacement, the smaller this. Same thing with your body, right? You're going to, if you're too big, you're going to be displacing a lot of air.
Yep. So it's another option. You may see it on your timeline. I don't really know if it's.
I just don't. I don't know. To me, I think the bioelectric sounds great. Abdominal. So far, for me, the two are the abdomen hit ratio.
Okay.
Number one. Number two, the bioelectric. I think those two sound reasonable. Everything else here, we'll see. Now we're going on to, what are we calling these? These are medical kind of grade options for measuring body composition. They're accurate.
They are, and we see this sometimes when we're looking at some of the studies that we review for weight loss, and we see, they performed a DEXA on these participants. Okay, we can trust these results.
Yeah. So these are tests that are often done in the studies, done with professional athletes. A lot of Olympians do these things in preparing for their events. So these are, and one of the reasons that they're at this level is the accuracy. You can really count on these to be consistent from test to test to test. And that first one you just said is DEXA, right?
Yes. So that's
same thing for your bones.
Right. Exactly. And so that's really nice to see if you are, if you have access to this, then it's just another way to give you estimates of bone mineral density and adipose tissue. And then I'm sure you're familiar with some of the others.
Well, DEXA, first of all, you can, but it's not, if your doctor only orders a DEXA for a bone, it's not completing the picture. Right, because your radiologist is going to. We're not looking at anything else. It's not titrated right for the tissue. If you're just doing bone, even though it's DEXA, it's a little different.
Yeah.
So you have to be clear that this is not for bone density. It's for body composition, and it's a slightly different test. Same machine, but you the dials you change them a little bit, and that allows you to do body composition.
I could see how this can be very important for individuals as they're getting older, like elderly, because we see weight loss in those individuals. They're losing bone, we know, but they're also losing muscle. And to try to identify the extent of that muscle loss and to see if they're what we sometimes call skinny fat.
Yeah. That's right. That's kind of a newer thing that we're hearing, like the skinny fat condition of older people. Moving on, the next one is just an MRI. MRI is going to be great at distinguishing fat versus muscle. I mean, that's what it really is going to be good at. And so, again, a lot of athletes do this. They want to see the fat go down, the muscle go up. It's mostly looking at skeletal muscles. I think when if you're going to do the MRI for this, you're probably focused on larger muscle groups. You're probably focused on thighs, lower leg, maybe chest, arms. I'm not sure how much they do the abdomen here. I guess you could, but there's so many organs in the way there, that's going to make it a little bit harder to kind of test. So, that's my guess. I'm not sure what they really, but I can see how this can be used if you're really trying to build muscle, and you really want to measure that result. Maybe if you're a boxer, you're a wrestler, whatever that may be, that might be useful for you.
Okay.
Now, quantitative MRI. This is just a little more fancy.
Okay.
That's all. It allows you to make better calculations of fat to organ to tissue to water ratios.
Okay.
It's more accurate.
All right.
That's all it is. It's just a little more accurate. Not cheap.
Well,
the software for this is not cheap.
Not.
Yeah.
I got an MRI a few months back, and it was almost $400.
Yeah,
not covered by my
a QMRI
insurance.
could probably be 50% more, even maybe
Wow.
double. Yeah, it's an expensive. It was the original ones were called echo MRIs, and they were used a lot in people who were cachectic.
Okay.
In trying to measure the rate of cachexia, which is like a wasting disease in HIV. I think that's where it was mostly used, in the 90s.
Okay.
In chronic infection people.
Okay.
So it's just expensive.
And then there's underwater weighing. I remember learning about this.
This is kind of old.
This is old. Yeah, this is old school techniques that you see in some of these. I don't want to say, I guess, research big athletic, like Division I athletic programs where they have kinesiology studies and sports medicine.
Yeah.
And I remember learning that this is the best way to estimate, body weight,
I don't
body
think I've
volume.
ever actually seen this done.
I've seen it in on pictures when
So
I was
what
learning about it.
I'm trying to. So you have to. I guess you have to be completely submerged.
Yes.
And then that's when they. So what are we measuring? That water displacement versus, because we already talked to air. Is that where we're measuring?
Water displacement.
Okay,
And
so
you
this
can
is
look at
water
bone
versus air. I'd rather do the air. I don't know if everybody. I mean, some people can't hold their breath. I mean, how long do you got to stay under?
I don't know those details.
But there's, again, a lot of these things are used in research,
Yeah.
Used by professional athletes in very specific conditions, maybe chronic conditions that we even mentioned. Expensive. Is it absolutely necessary? No, but if you're really into that kind of stuff, go for it.
If you want to know this information, I think also understanding their levels. So that's why we started out with, the abdomen to hip ratio, something you can just get a measuring tape. You do it at home. You can do the calipers at home. Very simple.
That
then
first
next
step that
level,
we talked about.
right?
Yeah.
And then there are, because what's going to happen, and the reason we're kind of going over all of these different options is you will read about each option and then read about their limitations, and people will say this is inaccurate. So there are levels of getting more and more accurate, and so for the person that is the overachiever and they want the best of the best, I would say go for it.
Go for it. Yeah. Go for it. Just make sure if you're going to do, when you measure your waist, do it do it correctly. Whether you're using a measurement around your waist or you're using the caliper, you gotta grab that fat. You can't cheat and grab just a little bit of it. You got to really get it, because we like to cheat ourselves, don't we? Right? Oh, look, it got better, and you barely pinched anything on it, right?
Yes.
So you got to be honest if you're gonna if you're really gonna do all that. But don't let this. I think you're right. Don't let this kind of stuff take away from the focus of really just the healthier lifestyle, the good food, good social interaction, being active. We're not even calling it exercise. It's just being active. Find that thing that you like to do and get outside. Even if it's a walk, walking's fantastic.
Yes.
Do that kind of stuff. And as you said, a lot of this will fall into place. Things will improve for you, I do think, over time. That's your focus. And these things are simply tools that maybe will help you get there maybe faster or have better results. But that's all they are. They're just tools. They're not the end game.
They're not the end game. And we also know that there are, when we look, the whole purpose behind all of this, right, is to reduce your risk for chronic disease, cardiovascular disease, cancer, even, arthritis, sleep apnea. But there are many factors that go into the development of those, and weight is just one. And there are some people where they may be heavier and they aren't dealing with those.
You see that, right?
Right. They're not dealing with a chronic systemic disease state. So I just wanted to point that out, that we are very well aware, we're not promoting that the weight is ultimately an issue.
You're spot on, because, even as a clinician, it's well known that if a patient comes in, let's say you never met this first time new patient, right? If the person looks decently lean, that you don't ask them anything about diet. You don't say anything about it. But yet you don't know if is that person malnourished.
Right. Maybe do they have an eating disorder?
Maybe they're skinny, but maybe they're just still eating junk.
Right.
I mean, and maybe there is inflammation and all that kind of, but yet if somebody looks just a little overweight, it's like, well, we got to focus on.
I know. I think that's horrible.
Right there is a discrepancy and a biasness. Right. So weight is just one issue of overall health, and just there's so many other components to it. And so don't just get stuck on that scale,
Yeah.
I think this is great.
Yes.
There is some more information about BMI, BMI getting improved and all that kind of stuff. I don't know if I want to dive into all that, but at the end of the day, again, BMI is just another tool. It's just tools. That's all these things are. If you want to learn a little bit more, first of all, our sponsor, Life Extension, they want to say thank you. Mm-hmm. So if you go to lifeextension.com, you can go ahead and use the discount code
podcast.
Is that how we're saying it for 2025?
Podcast.
But not podcast. Podcast, and you'll get 10% off when you spend $50 or more plus free shipping and handling. That's podcast at lifeextension.com. And listen, a great place we can also send people to is our health education hub.
Yes.
What is that? That's lifeextension.com/
Education.
Mm-hmm. Great place to go. A lot of articles there. So check all that out as well. We appreciate you guys listening. Don't forget, you go to liveforeverish.com and download a bunch more episodes. And when you do, please like, share, and comment. We really appreciate that type of engagement. Wherever you're at, if you can give us a ranking, that's big now too.
Yes.
We got to be ranked. We got to get some stars. So give us some stars wherever you listen to us, whatever your aggregate is, as they say. Go ahead and do that. But we do appreciate it. That's at liveforeverish.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.